Samantha Lara, and this is my venipuncture practice on a real arm. First, I'm just introducing myself and getting the patient's consent.
I'm Samantha. I'm going to be doing a venipuncture today. Can I get your name and date of birth?
I ask and verify the patient's name and date of birth. Now I just wash my hands with some hand sanitizer that's at my station.
For volunteering.
Oh, thank you.
Step is to gather my supplies. I get a gauze pad, a tourniquet, an alcohol wipe, bandage, gloves, my needle, my vacutainer, and my vacutainer tubes to hold the blood.
Miss.
Hi, Miss Leon.
Now I put on my gloves.
No, where? No quiere. We never blame the patient, remember. What happened?
Next, I put the tourniquet on my patient. I make sure not to put it super tight, but tight enough to where I know I can get some good blood flow.
You need to take a break. Yeah, you need to take a break. You need to take a mental break.
Next, I palpate for the vein.
It's up to you. She's offering. Take the offer.
I don't feel confident.
I clean the arm with an alcohol wipe in large circular motions, making sure to get the majority of the forearm.
Are you scared of needles?
No.
No? You look really nervous.
I thought my patient looked a little scared, so I asked if she was nervous, but she said she was okay and allowed me to go through with the venipuncture. I cleaned my gloves with the alcohol wipe as well, which is why I'm repalpating. Now I performed the venipuncture, making sure not to go too deep in. I stick the tubes in. I'm careful not to be moving the needle in and out of the patient's arm.
I got one, but I didn't realize that while I was putting the other one, I dropped the needle and so I was saying, so yeah, the only good one I have
I'm just gonna do two for you. I removed the tourniquet once I felt good blood flow. I was gonna go for another tube, which is the yellow one, but I decided to stop after the red. I take a piece of gauze to remove the needle and throw it in the safety sharps container. I then ask the patient to apply pressure.
Is readjust the needle, and then you're gonna start the blood flowing again. So that's what happened because she took out the That's when we get it out. If you don't have the blood, when you start getting it out,
I get a marker so I can label the tubes. I put the patient's full name, their date of birth, their identification number if they have one, and my initials. I ask the patient how she's feeling as I label the tubes, and she says she's doing good. Now I check the site and place a bandage over the gauze. Now I clean my supply area and remove my gloves in a proper manner. After thanking my patient, I wash my hands.